Okay. Okay, so right now we're gonna be going over chapter 40, cardiac glycosides, which is what the main focus is heart failure. So with that, you want to know the characteristics of this first. So you know there's acute heart failure, and then we have acute heart failure is like what it is, like acute. So it happens on set or within the moment. And in the book, it mentioned that this is when the um, what's it called? It's when the heart becomes congested, which can cause a decrease in pumping, which can cause a pump failure. And it also, the heart muscles also weaken and enlarging. So basically, it's like an enlarged heart, but it doesn't have enough strength to fully contract. So it's kind of like just, you know, it's not pumping out what it really needs to be pumping out. All right, so that's acute heart failure. Then we have right side heart failure. Over here, the little heart that I made. Um, Basically, think of it as like the diagram of the heart. So you have your supravena cava and your inferior vena cava, and basically blood is trying to go in, but it actually goes back out into the periphery. So your arms and your legs, which can cause edema and clotting and stuff like that. You don't want it to go back to the periphery, and that's the right side. And then we have left side, which is over here. So when the rich oxygenated blood is coming back into the heart, trying to go to the aorta, it instead goes to back into the lungs, which can cause like maybe like fluid buildup in the lungs and stuff like that, or it might cause infections. I don't know about pneumonia or acetylalasis, whatever it's called, but just know that left side pushes back into the lungs, and then right side pushes back into the arms. And then we have this little diagram. I wrote it down. I don't know if it's gonna be important, but I wrote it down just in case. So A being the high risk for heart failure, B is structural heart failure, disease without the signs and symptoms, right? And then C is structural heart disease with signs and symptoms. And then D requires specialized training. So I really think it goes from least to greatest, really. Like I think A is like you're at a high risk for having heart failure. B is like you have a heart disease like heart failure, but you don't really see the signs and symptoms. So you're like a level 1 technically. C is structural heart disease with signs and symptoms. So I would say that's probably like, the thing. It's kind of like heart failure. I don't know. And then D is requires specialized treatment. So like that's gonna be like your certain medication routines, your certain diet routines, different consultations and stuff like that. And then over here, the mechanism of action is the heart muscles weakens and enlarges, which causes pump failure, and it can be congested. And then we detect these, there's lab tests. So you're gonna check your BNP. This is your brain and something. But you just need to know that the desired value is less than 100, and then the positive volume is greater than 100. So if it's greater than 100, you most likely have heart failure. And then you also want to check AMP. I don't know the N, but I know it's brain something peptide and atrial N peptide, and it's going to be 22 to 77. So think, okay, I'm adding 22 to 55, which is 77. So 22 to 77. Okay, and then over here there's the non-pharmacological techniques that you use. So you limit salt intake 2 grams per day, or anything, just nothing with salt in general. Because salt, think of like sodium and potassium, highly with sodium. So if you have a high sodium diet or a high sodium meal and stuff, that will increase your blood pressure, and it's not good for the heart. And then saturated fat, so I put on like burgers and stuff, so like all that greasy type foods, because that can increase the congestion in the heart. And then you want to limit some fluids. I don't know why. I just know you want to limit fluids. I would assume because of like the pushback. And then you want to avoid alcohol, of course, like you always do. And then you want to stop smoking as well. And then you want to perform mild exercises. You do not want to perform severe strenuous exercises because that can cause heart strain, that can cause strain to the muscles. But you can do mild exercises in order to decrease your weight because obesity can be a factor to cardiovascular problems. And these are just like the beginning of chapter 40. I'm going to go on to the medications next.